Hello, our viewers. Today we are going to talk about a very interesting topic, which is the truth about syphilis. So, as far as I've known, syphilis is a disease that can be detected and that can be cured completely. However, because of fear and ignorance, some people neglect or sometimes they ignore syphilis and they let syphilis change to a late stage. And it is possible that they suffer from permanent damage caused by syphilis. So today in our live stream, in order to help our viewers know thoroughly about this disease, we are going to talk about the truth about syphilis in this live stream called Big Talk, Small Talk with our very special guest today, who is Mr. Nguyễn Anh Thuận, a medical advisor for GLant Clinic. Please welcome.
Thank you. I'm trying to make it more interesting and more funny, not scary. The
Okay.
topic. Okay. So although, like as you say, it's a little bit like scary, but I try to make it fun.
So you mean that I was introducing the syphilis so scary, right?
Yeah, I don't want people too scared. Yeah.
Okay. So can you give our viewers a little information and background of yours?
Yeah, sure. I'm a medical doctor, a general practitioner. I have a master degree in tropical health. I'm an advisor for GLant Clinic. I'm also practicing at the District 4 Hospital in Ho Chi Minh City.
So how long have you been in the health field?
Oh, I've been in the health field over 15 years, and all on mostly on sexually transmitted disease.
Oh, that's quite a long time.
Yeah,
Okay,
I'm old.
Now you do not look old. And to give you a little more information about GLant Clinic, it is a popular destination for vulnerable communities such as LGBT communities. And GLant always take good care of our customers and always put the most friendly, responsible, caring, and empathy on top.
I know. I'm very excited and being.
And you know what? In 2018, GLant welcomed more than 3,000 customers who come here to be consulted and help with sexual transmitted disease and especially HIV.
Yeah.
So our live stream today is part of the series called Big Talk, Small Talk, a live stream and broadcasted on Facebook in order to promote high-risk behavior change of the community and build a better society. So if you happen to see our live stream, please don't forget to give us a like and give us a share so that your friends can know more about this disease, which is called syphilis.
So like and share, right?
Yeah,
and
like
comment.
and share and comment. Comment any questions that you might have while streaming.
Yeah.
And in case you want to be consulted privately, please drop a message on our Facebook, which is GLant Clinic Pharmacy, or you can just visit us on 119 Tân Bình Trọng, Ward 2, District 5, Ho Chi Minh City, and our hotline is 0943 108 138. So, Dr. Thuận, are you ready for our questions today?
I think so. Don't you think?
Okay. As far as I've known, syphilis is a sexually transmitted disease. So I think that our viewers would love to know the meaning of the phrase sexually transmitted disease.
Yeah, thank you. The reason why we chose the syphilis as a topic, because it's pretty popular.
Popular, yes.
Because like in the field research that I read and I was involved, we found out that like up to 20% of men having sex with men.
20%.
Yeah,
That's quite high.
have syphilis, like diagnosis, and it could be higher among a group of like pregnant women also. So it's very popular. It's prevalent, and that's why we need to know. And the good news is that it's curable.
It's
So,
curable.
yeah.
It's quite a good news.
Yeah.
So compared to HIV, is syphilis more popular?
Yeah, it is more popular. The rate is higher, much higher, and the thing we need to note is that people can have two, HIV and syphilis
At the same time.
at the same time. So
Yeah.
we call it co-infection.
Co-infection.
Yeah, and particular when I'm consulting clients at GLant, I see a lot of people who have HIV positive, also who has syphilis.
Yes.
And particular in the area of PrEP, pre-exposure HIV prophylactics, we see more and more people with syphilis.
So syphilis is very popular.
Yeah, I would say it's a matter of
Yes.
concern.
So can you give our viewers a brief definition of what syphilis actually is?
Yeah, I tried to make it very simple
Okay.
for a viewer to understand. It's a disease and illness caused by a bacteria called Tribonium pallium. It's the bacteria lives in at the genital part of the body, and then transfer to other part of the body. So syphilis is a systematic disease. It's not like a focused disease. It started with sexual behaviors, and it started at the sexual organs, and then it spreads
all over
like
the body.
all over the body.
So that's the reason why you call it a systematic
Yeah.
disease, because it starts at the genital, right?
Yeah,
But then it spreads all throughout the body.
yeah.
Okay. So can you be specific about the syphilis pathogens and manifestations?
Yeah, sure. The bacteria is it's very easy to find out through a test, and particular like when you use like symbol machine, so basically it lives it stay alive on genital organs, genital fluid, blood, and other body fluid.
This sounds a lot like the pathogens of HIV.
No, it's different.
It's
HIV
different?
is virus, and
This
syphilis
is bacteria.
is bacteria.
Bacteria, okay.
Yeah.
And its manifestations, doctor?
So what you mean like how you see it on the body?
Yeah.
So basically, the people
With syphilis?
or exposure,
Yeah.
with exposure to syphilis, we will have different stages. Like early stage, like it mostly lasts for like a week or two or 9 weeks without notice. Some people, particularly in my experience, I see some little small lesion, at the.
Can I say it dots?
Yeah, like a dot lesion on a spot, very small one.
Small one?
Particularly if someone who have unsafe sex, and then if you have unsafe sex, and then there's some spot on the lesion, you should care about.
But it must appears on the genital part, right?
Mostly. Yeah.
So how can I identify it and identify it between the normal acne or pimples?
Yeah, it to do with mostly like the sexual contact that we have. I mean, acne, pimple, basically, it's a face,
it's on the
facial, like problems.
Yes.
But this one at the sexual organs, and Particularly, I have to talk a little bit about men and women. For men, sometimes it's easy to find out, at the
On the part of the
part of the genitals.
Yes, of the genitals.
It there. But for women, sometimes because like the vagina and and cervical part of the female genital is very deep and hidden, so
Yes.
it's hard to find.
Yeah, so sometimes the syphilis symptoms appears inside the genitals.
Yeah, sometimes the
Like
damage, the lesion
Yeah.
is
Hidden.
is hidden.
So, what are the specific and particular symptoms that someone needs to pay attention to?
As I say, it's we call like syphilis lesion,
Yeah.
and that you're very lucky to see at the early stage, or sometimes basically there was like unnoticed. You cannot find.
You mentioned about the early stage that which is we do not see lots of symptoms
No.
of syphilis. Can I call it giai đoạn cửa sổ in Vietnamese? Is it like HIV?
It's a bit different because we call it like early stage, and then the or primary stage,
Primary stage.
and then
okay.
secondary stage. So the primary stage is about like 9 weeks, and then it moved to secondary stage with like less than a year, and then after that it late or latent stage would be over 1 year, and then and some people don't recognize any symptoms, signs. Or illness that they have until the late stage.
So, what symptoms would there be in the latent stage of syphilis?
Yeah, so before talking about latent stage, I talk about early stage. Basically, if you see any lesion like after unsafe sex,
yes,
or contact with any fluid that you think that could potentially pass on or make you like exposed to syphilis. So like pay special attention. Remember that sometimes you don't see anything.
Yes.
Okay, and then in the secondary stage, you might see some spot or rash.
Oh, so that's when the syphilis spread all over the body, right?
Yeah, and spread, and also and the whole like body systematically reaction to the bacteria.
Can I call it inflammation?
No, it inflammatory reaction, but there were some like rash and spot, like
yes.
Particular in the like at the palms,
Yes,
in the
yes.
hand. In my experience, when I see people with high risk and with like spot, a rash, or like little small all over their palm, I immediately think it's syphilis. And as a general practitioner, you should think about syphilis.
Yes. Does those rash hurt?
It mostly don't hurt, but it could be irritating, or itchy.
Itchy. Okay. So can I confirm again that syphilis has total of 3 stages? The primary stages, the secondary.
Yeah, like primary stage, secondary,
and
latent. I would. Some people divide it into 4 stages, but I think that it doesn't really matter. The most important thing is we pay attention to it.
Yes.
We
pay
care.
attention to the symptoms.
Yeah.
Okay, so let me confirm again. So syphilis is caused by bacteria, and it is divided mostly into 3 stages: the primary stage, the second stage, and the latent stage. So another question for doctor: where could syphilis be in the body besides the genital part?
As I said, it go into the bloodstream.
Bloodstream, yes.
And go into in the latent stage, it go and it damage the neural system.
Also, it also flows into the brain.
It's not the brain. It's the neuro. It's not only the brain. It's the nerve, particular peripheral nerves,
Yes.
particular like the nerve outside. It could go to the central nervous system, but it but rarer. Um, and then it could go into the heart.
The heart also.
Yeah.
So what would it be if the syphilis come into the heart?
It will cause a kind of inflammation of the heart valves. So it can cause like obstacle of the bloodstream.
Yes.
But that those things is become rarer and rarer thanks to the advanced treatment these days.
So what happened if that patient does not get any treatment of the syphilis, and the syphilis has come to his has attacked his heart?
Yeah. So basically, it will as I say, it will cause like cirrhosis and of the valves and also cause inflammation inside the heart.
Would it make the patient hard to breathe?
No, it just later and later it will cause,
okay.
but as I say, it rarer and rarer. In my experience, I mostly see like at the secondary stage, like people who have it within a year and thanks to like the regular test and screening exercise that they discover.
I am really curious about the test and the screening exercise that you just mentioned. So we can just detect the syphilis easily by a simple test?
Yeah, basically the most common test is VDRL, and we call it used to be called like if you call VDRL, everyone knows.
Yes.
It's a non-tribonium test. It gives very in early stage. It normally gives a very sensitive and like the result. But and then there are also other tests, particularly in symbol language. I have to put symbol language for people to understand. It's
Yes, I understand.
what we call like it's a kind of indicative test, and it's a confirm test, and also like a measurement that basically measure the severeness or severity or like the amount. Okay, I have to put like the amount of syphilis, antigen and antibody in your body.
So that's quite a lot of tests.
No, it's like most of like the test at GLant, they will start with VDRL. Okay, so it's a simple test, very sensitive. It gives positive, and then we move to like a more advanced test.
Yeah. Okay.
Yeah.
So I'm curious. After the syphilis has spread from the genital part, does it keep flowing all over the body and keep damaging the body, or sometimes it stay at a specific place of the body?
Yeah, it's normally it will stay in the genital organs for some time, and then it will go into bloodstream, and then spread, and then it start like growing, like the bacteria start growing.
Duplicating, right?
Yeah, duplicating, replicating.
Replicating,
okay. Replicating.
Yes.
And then over the time, it will cause damage. It won't give the damage of the target organs immediately. So that's why a lot of people don't have any signs.
So it takes
in early
time.
stage. It takes time.
Okay. And what are the pathways that syphilis can be transmitted through, doctor?
Mostly through penis, vaginal intercourse, or penis anal,
yes.
intercourse among like men having sex with men. Some also have syphilis through oral sex.
Oral sex also.
Yeah, it bit rarer.
Yeah, okay.
We don't have the data for oral syphilis in Vietnam yet. I would like to have some data on this, but you know, like regardless, like how high the syphilis can be transmitted through oral, sexually, you know, like sexually intercoursing, you know, behaviors.
Yes.
We just need to be aware of it. Yeah.
Yeah. Okay, so syphilis is caused by a bacteria.
Yeah.
So I would say that the treatment would be antibiotic.
Yeah.
Yeah.
Before talking about treatment, I like to talk a little bit about the type of
Syphilis.
no, the type of people that really need to pay attention.
That are high risk.
Yeah, the high risk
yes,
population.
Okay.
So as we know, like gay men, you know,
Yes.
bisexual men,
Yes.
women like working in sex work, or any people who have like polygamy, you know, relationship. You know, could be boyfriend, girlfriend, could be like
Anyone.
Yeah, anyone. It doesn't
Yes,
have to be. And
yes.
I'm not judging people based
Yes,
on
yes,
their
yeah. Sexual,
relationship.
yeah.
Sexual. I'm just like
Yes.
them to be aware that even like one time without condoms, you could expose to syphilis. So remember that it not a multiple time of unprotected sex. It one time could cause.
So the lesson here is that one time also could cause us to be infected by syphilis.
Yeah.
So we have to always be aware of it, right?
Yeah, and
Okay.
then take action, test and like
Yes.
regular screening and things like that.
So let's get back to the treatment of the syphilis. So am I right if I say that we treat syphilis with antibiotic?
Yeah, you're right. So before treatment, we need to do like the diagnosis test. As I say, VDRL, and
Yes.
then the what we call the quantitative test, which measure the amount of bacteria and antibody in your bloodstream.
Yes.
As a baseline.
Yeah. Okay.
Okay, as a baseline.
So we need
So
a
the
baseline.
Yeah, we need a baseline. This is important because some people, you know, come in and say, you know, I have syphilis, and then we start the treatment, and then like 3 months later, they still have syphilis. But the reality is that it responds to the medication,
Yes.
but we need to know how well it responds.
Okay.
That's very important. So remember that is the optimal measurement that I would recommend.
So in order to get in order to be prescribed and treated, we need to have the test first in order to confirm our status.
Yeah,
Yeah.
how severe it is.
It is.
In what stage are you at?
Okay. So
and as a baseline, so we
Yes.
can follow over the year, because it can be recurrent.
oh,
You know, like it
I thought that if we use antibiotic, it would be completely.
Yeah, the antibiotic is very effective, but the possibility for recurrence or reinfection that
Yes.
you don't know. Like there is no way that we can
Yes.
control someone's behavior,
Yes.
and we should not control anyone's behavior. All we need to do is making sure that it's not recurrent and it's not reinfected.
Okay. So I am someone who is really sensitive to antibiotic, and
Yeah.
allergic to lots of antibiotic. So what happened if I am infected by syphilis and I'm allergic to most of the antibiotic at the moment?
It's a very ideal rare case. Before talking about like the allergic reaction to the antibiotics, so basically I like to talk about the name of the drugs.
Yeah.
So basically, benzathine penicillin is still effective worldwide. Okay,
Yes,
so
okay.
we should not worry that the benzathine penicillin
Could
is,
cause allergic.
or could cause resistance. The
Okay.
resistance is still very low.
Yes.
Okay, so benzathine penicillin is still working fine. So
Yes.
don't worry too much about like the resistance. Come in, have a test, get treated, and we observe. We help you to observe.
Okay.
And monitor the illness. Yeah. So and then benzathine penicillin works well. The injection is a bit painful. So
It is painful.
it's a little bit painful,
A
but
little bit, okay.
I know that the GLant nurses is very
We call mát tay in
mát
Vietnam.
Thai,
Yeah,
very
yeah, mát tay,
capable
yes.
and very skilled. So
Yeah,
I
skillful in this,
I wouldn't
yes.
worry too much about this.
Okay.
And they give you a head up of like how the medication works. So don't worry. But some people could be allergic to penicillin. So regardless whether someone who allergic or not, we have to do like an allergic test.
Oh.
So
Oh, it's like injecting a little bit of the antibiotic in my hand, right?
yeah. So we
I used to have it.
Yeah, so basically it's the subcutaneous. It's subcutaneous meaning like under the skin.
Under the skin.
So they will inject like a little your small doses of penicillin.
Okay.
Under your skin, and then can I borrow?
Yes.
And then
You
like,
can practice it on
yeah.
my
So
hand.
basically like if the nurse inject like a little bit in under your skin, and then she or he will mark, and then write out like the minute. Okay, so it normally like and then timing.
Timing.
So like the practice is about like 10 to 15 minutes, and so and then if the if there's an allergic reaction, you see the rash getting bigger and bigger. Could be together with like irritating feeling and itchy and
Sometimes headache. No.
and headache or
Okay. So.
difficult in breathing.
Yes.
But still, in my experience in medical practice, in medical statistics, the rate of penicillin allergy is still very low.
No. Okay.
So making sure that you have a test.
Okay.
Tell your doctor and the nurses that you are allergic to any medicine, not only like antibiotics,
Yes.
but also if you have other illness like HIV, particular you've been on ART for some time, or you haven't started ART, like the immune system could be a bit weak, so the reaction is not clear. So tell your doctor and your nurses what you have.
Okay, so there is a phrase in Vietnamese which talk about the syphilis, and I do not know how to translate that into English, but I would love to know more about it and how it actually looks like. It might look like on the body. It's called sang giang mai.
Yeah, it's a small spot, and it a bit pink, and with some layer, like a white of the skin layer on it. So when you can easily like use your hand,
Oh, really?
or use the stick and like you know like
Would it bleed if you do that?
It normally don't bleed, but if someone who are in severe cases, it could give it bleeding. But normally it is not harmful, but it keep coming if you don't have a treatment. So the spot will keep coming out.
Yes.
Some people come out a lot.
Oh.
Yeah, and they don't know what it is.
So.
But and then the rashes and the spot will go away very early after you start penicillin.
Oh, okay. So does this sang yang mai appear in everyone who has syphilis?
No, it mostly in the late stage.
Oh,
of
late
the
stage.
syphilis.
Okay.
Yeah.
So.
So, if you see if you have unsafe behavior, you haven't tested syphilis, or you've been you was treated with syphilis quite a long time ago, and now some rash coming up, you should think of
Syphilis.
infection or recurrence or reinfection.
Yes. Okay.
Think about it and come for test
And have a
then
test.
And then
Get treated.
And the rash will go away.
Okay, so I've heard a lot about syphilis. When someone has syphilis, there are usually lymph nodes appear on the body.
Yeah, it could give some lamp note, but it's very rare these days.
Very rare.
Yeah.
So if it appears on the body, where would it be? Under the pit arm?
Yeah, in the pit arm, could be like
on the neck.
The neck,
Yeah.
like behind your ear, and sometimes like around your genital body part. But it's the note become very like rarer and rarer. Some people would like skinny type. Maybe like you,
maybe like
skinny,
skinny.
hot, skinny body. You can find it easily, but it's not very common.
Okay, so
I wouldn't be too scared about it. I say I like to make it fun and and easily understood.
So
for you guys.
let's get back to the stages of the syphilis. So I would like to know how long would the early stage, or we can say the primary stage of syphilis last?
Yeah, it could last for like 9 weeks.
9 weeks.
Yeah,
That's quite a long time.
It's quite a long time. So
Yes.
and then it go into a secondary stage with like from 9 weeks to a year, and then after a year normally it late. But again, don't worry that it late or not. The medicine, the benzathine penicillin is still working fine.
Yes. Okay. So the manifestations of the early stage sometimes, or I can say usually, disappear after a while, as you have shared, right?
Yeah. So it sometimes and it goes away and you don't notice that you have anything.
Yeah. So which makes people think that they just have normal pimples.
It will be unnoticed. So
Unnoticed.
And then,
yes.
but it is still transmittable to other people.
Oh,
so that's the most important
that's
thing.
the question I'm going to ask. So in the hidden stage, I would say the hidden stage. So it's still transmittable to other people, but through the flu,
through sex,
blood,
mostly sexual contact. Because for blood transfusion, people do testing, so
yes.
I wouldn't worry too much. Mostly sexual contacts.
So there's a phrase I see in this, which is the outbreak period of syphilis. So can you give us information about this outbreak period, or I can say the outbreak stage? Is it the latent stage?
I don't know whether it's outbreak stage or not, but any stage could be transmittable.
Transmittable.
And normally we use the term like outbreak state for public health expression, meaning that in the city, for example, in a few years ago in Ho Chi Minh City, there's a big outbreak.
Oh.
So like so many people have syphilis. Maybe not because like a lot of transmission going around, but maybe people aware of the situation, go for test, and then you will see a high number of people who test who has had a positive test, and then people get managed, so it go down. So, but remember, it's a year-round illness, and it's still very prevalent in
Okay.
in the city.
So let's talk about the last stage, or let me correct, the latent stage of syphilis. So what are the serious complications of syphilis in the latent stage? The really serious complication that one can suffer.
Yeah, in among like gay men and homosexual men, bisexual men, the consequence mostly like a lot of rash and spot like in their hands. It make them looks not very attractive and irritating.
Yes.
We hardly see like really late stage. As I say, like particular in southern Vietnam, in Ho Chi Minh City, people go for common health tests more regularly. So and we see like less and less. But like, if someone who develop late stage, you see like really a lot of rashes or spots like in their hands, in their body. It go up and go down. It repeatable all the time. And I don't want people to be scared of the really bad consequence.
Yes.
But as I say, it can cause like neurological consequence, it cardiac consequence.
Additionally, why would us be feared of this when there's antibiotic, right? Because this is caused by bacteria.
Totally.
So no need to be too scared of this, but we need to be aware of it.
Exactly.
Okay, so let's get into the questions of our viewers. As I can see, we have quite lots of questions. So the first question is, HIV, HPV, and syphilis, are they relative?
Yeah, these are very common sexually transmitted diseases. People can have three of them.
Three of them at the same time?
At the same time,
Okay.
co-infection. Or
yes.
more than that, they can have HIV, HPV, syphilis, gonorrhea, and like hepatitis B and C.
There's quite a lot.
Yeah, it's okay. It's manageable.
Okay.
I wouldn't worry too much about it. And there is HIV. Basically, I have to talk about like GLant experience. In my experience, that we see, as I stated before, we see like very commonly that people who have HIV positive, newly diagnosed or already on treatment, who have syphilis. We see more and more people who are on PrEP, who contracted with syphilis.
Yes. So let's get to the next question of our viewers. So my friend always use condom when I make love. So why does he have syphilis?
Yeah, maybe I don't know for sure the behavior. Maybe he has syphilis before you guys dated. And maybe his syphilis, you've been on the silent stage and on the early stage for some time, and you don't know, and maybe he had before and he had treatment, he didn't tell you. But I understand your question. You care about, you're concerned about it, but just have your boyfriend tested, yourself tested, and get treated. And the question is answered.
Okay. So when I read this question, there is another question that comes into my mind. So, can condom be used to prevent the syphilis infection?
Totally. Condom is the most effective, and actually it's the only effective measure.
So it would only be transmitted in unfortunate situation like the condom breaks.
Our people don't use condom.
Okay.
So
let's get to another question. I have syphilis. What will I do? The test first, right?
Yeah, the test first, and
Okay.
the test, the confirmation test, and the test as a baseline, and then start your penicillin injection as soon as you can, and then retest like after 3 months. Very important that you come back for a test.
So if he or she or any of our viewers want to get tested and treated, where would they go to? Where is the trustworthy places?
Yeah, so like the most of the good clinic or hospital, general hospital could have a syphilis test.
Yes.
And treatment. So the community group like clinic like GLant, GLant, could give you good advice.
Okay.
You can go to the dermatological and venerable disease hospital as well. So make sure that you have a good test. Oh, another thing very important that I like to note to recommend that you should stick with one good clinic.
Good clinic.
Because the clinic, if you go for different clinics, it can yield different labs. So sometimes the result will give different outcome. So make sure that you go for one clinic and have the baseline test and the middle term and the end line test all
in one clinic,
all in the same lab,
okay.
or by the same techniques.
Okay. So I'm curious, is all of the tests and treatment of syphilis covered by health insurance?
I heard that it will be soon, but for now it not, but it will be, it should be.
Is it costly?
No.
The treatment and the test of syphilis?
No, very affordable. Most people can afford.
Okay. So another question from our viewers. I am HIV positive. Can I have syphilis treatment also?
Yeah, you can totally, and it's recommended for HIV positive people who undergo like syphilis test and treatment ASAP.
So, is there any interaction between the syphilis medication and the ARV?
No. There's
so,
no
so
interaction.
A patient can take both of the medical pills at the same time without any interaction?
Yeah, there's no interaction.
Okay, so I also really wonder if is there any effective way to protect ourselves from syphilis besides using a condom? Is there any preventive medication? For example, when we talk about HIV, we have PrEP. So what about syphilis? Do we have any preventive medication?
Unfortunately, no. Condom is the most effective way, and having non-penetrative sex, meaning like basically like
non-penetrative.
Non-penetrative sex, meaning
okay.
like you just masturbate together, kiss and things like that. But like, don't worry too much. Enjoy your life. Wear a condom as often as you can enjoy your sex life, have regular tests. Don't be too obsessed about this. Okay.
Okay. So I think we have come to the very last question. And this is not really a question, but I would love you to give our viewers any advice about the syphilis.
Yeah,
Use condom. Use condom.
my advice is, like basically enjoy sex. Be as safe as you can. If you are on PrEP, I really admire what you do for your health.
Yes.
Remember that beside PrEP as a way to prevent HIV, syphilis, and other STD could be like a risk. So have a regular test. It's very easy. Call GLant, call like the clinic near you, and then people will ask you come in for test, or they can come to visit you.
So the message of our today live stream is to get tested regularly.
Yeah.
And get treated and just enjoy your sex
Enjoy the
life,
sex
and don't
life.
be too obsessed of these diseases,
Yeah,
because
that's
they are,
why-
because they are curable, right?
It totally
Yes. Okay. Thank you very much for joining with us today. We have lots of informative information and useful information from Dr. Thuan. And don't forget to hit the like button and share our live stream so that our friends can know more about syphilis. And if you have any further question, please contact us on Facebook, which is GLant Clinic Pharmacy. Or you can just visit us on 119 Đường Bình Đồng, Ward 2, District 5, Ho Chi Minh City. And don't forget, our hotline is 0943 108 138. Thank you very much. Bye bye.
Yeah, I like to make it fun. I hope I have been a little bit like fun, not too boring.
I believe that our viewers have really great moment with our live stream
So
today. It's really
comment
comfortable.
comment if you feel it's boring, and I can work to improve.
I think it's really interesting today.
Thank
Thank you
you.
very much, Dr. Thuan.
Ciao, ciao.
Bye-bye.
Have a nice evening.